This is a disorder which is related to the SA node. Or still we are in those abnormality which is related to the SA node. We still discuss about the SA node, and just one lecture that is called sinus arrhythmia or physiological arrhythmia we will discuss in the future days. Right now again I will start from sick sinus syndrome. What is the sick sinus syndrome? First definition. What is the sick sinus syndrome? As the name suggests, the sick sinus syndrome represents or shows a collection of impulse generation as well as conduction disturbances which is related to the SA nodal dysfunction. In fact, the sick sinus syndrome is a disorder of the SA node. Remember, any or all of the following, I mean sinus bradycardia, Sina arterial block, first degree, second degree, third degree SA nodal block is related to the SA nodal dysfunction. So any or all of the following problem may be seen in patient with sick sinus syndrome. Again, sinus syndrome. How should I discuss about the sick sinus syndrome, or how should I define the sick sinus syndrome? Sick sinus syndrome represents or shows a collection of impulse generation as well as conduction disturbances of the SA node, which is related to the SA nodal dysfunction. Under this topic, we should explain three things. Number one, sinus bradycardia. This matter is discussed already. And right now, the second one is Sina arterial block, first degree Sina arterial, second degree, and third degree Sina nodal block. When you are talking about the sick sinus syndrome, we should think about these three things. Sinus bradycardia, we discussed this matter or this issue already, and then we will be discussing about the Sina arterial block, first degree, second, and third degree is a nodal block. Right now we will start with our lecture from first degree is a nodal block. First degree is a nodal block. First degree is a nodal block is a block in which intermittent dropping of more than one beat. It means one beat is dropped, but remember, the second beat, one beat is dropped, but the second beat appears in expected place and expected time. This is very important in today's lecture. Expected time, expected place, and expected time. For example, this QRS complex and this is the QRS complex. Between these two QRS complex, 1, 2, 3, 4. We have got 4 large squares. The second beat we expect to occur here, but there is one beat is dropped. One beat is dropped, but the second beat appears in expected place and expected time. Did you understand? Yeah, we'll discuss again. In second degree Sina nodal block, there is intermittent dropping of more than one beat. In fact, one beat is entirely dropped. No P wave, no QRS complex. No P wave, no QRS complex. Neither atrial nor ventricular activation occurs. In first degree Sina nodal block, is characterized by dropping of one beat, but the second beat appears in expected place and expected time. For example, 1, 2, 3, 4, 1, 2, 3, 4. There is missed, but the second is appears in expected place and expected time. For example, 4 squares represent how many seconds? 4 square. 0.8. 0.8. There is a 0.8 second of time, but it is not occur here. It occurs again in expected place and expected time. One beat is dropped, but the second beat appears in expected place and expected time. This is called first degree SA nodal block. Remember, one we have got the SA nodal block, another we have got AV nodal block. You should not be confused about the SA nodal block and AV nodal block. Remember, when you are talking about the SA nodal block, you should think about the dropping of the entire beat. What does it mean, entire beat? It means P wave as well as QRS complex. In AV nodal block, just we have got P wave, but there is no QRS complex. So in sick sinus syndrome, especially in first degree, second degree Sina nodal block, in second degree Sina nodal block, one beat is completely drops, no P wave, no QRS complex, and the second beat appears in expected place and expected time. This is called secondary Sina nodal block. But right now, how should this read and how should I this mark? For example, this was one QRS complex, this is two QRS complex, the third is dropped. When you want to write it, you should write like this, 3, 2, 2. Did you understand? For example, one QRS complex, two QRS complex, the 3 is dropped. We have got 1, 2, 3. The third one is dropped. So we have got 3, 2, 2. One beat is dropped, but the 2 beat is present. It needs more practice. Yeah, it is a little bit difficult, but if you practice it, it becomes easy. This was about the first degree synovial block. I forgot to tell you about the first degree synovial block. First degree synovial block, from a first degree synovial block, we cannot be diagnosed from the ECG, because we don't have any drop beat from the first degree synovial block. But electrophysiological study, they reveals or they show slow conduction of the SA node. But over the ECG paper, first degree synovial block does not produce any drop beat. Does not. So if the first degree synovial block is a block in which we don't have any drop beat. So it is difficult to diagnose from the ECG. But this electrophysiological study provide information about the slow conduction of the SA nodal system. Did you catch? We'll repeat again. Yeah. Right now, for example, this is another example of the second degree synovial block. For example, 1 cycle 2 3. The 4 one is dropped. This is should write 4 to 3. Did you understand?
Yeah.
I have for example, when in first degree synovial block we don't have any drop, so and therefore we don't have any diagram or any ECG trace from the first degree synovial block. But electrophysiological study provide information about the first degree synovial block. In second degree synovial block, the expected time and expected place for second beat is for expected time. For example, we have got 1 KRS complex, 2 KRS complex, 3, and the 4 is drop. The 4 is drop. Right now we will again discuss about the second degree synovial block. What does it mean, second degree synovial block? In second degree, there is intermittent dropping of 1 beat. There is intermittent dropping of 1 beat, or more than 1 beat. There is intermittent dropping of the more than 1 beat. But the second beat appears in expected place and expected time. For example, there is 3 large square, this is 3 large square. But there is, the beat is dropped. But the next beat appears in expected place and expected time. This is called secondary synovial block. Right now we will be discussing about the third degree synovial block. Well, how should I define third degree synovial block, or those criteria which is made the diagnosis of the third degree synovial block? In third degree synovial block is also called complete synovial block. Or another, this is complete sinus arrest. Or they also say atrial standstill. In third degree synovial block, there is a long gap. There is a long gap. There is, for example, there is a long gap. And there is a long gap or prolonged causes of electrical inactivity of the heart. This is a prolonged gap, or this is the causes of electrical inactivity of the heart. And we also don't know about the next beat. The next beat does not appear in expected place and expected time. In the second degree synovial block, the second beat appears in expected time and expected place, and in the second and the third degree synovial block or sinus arrest, there is a long pause or there is a long gap, and the expected time for next beat does not appear in exact time and exact place. This is the difference between the second degree synovial block and third degree synovial block or sinus arrest. In second degree synovial block, we have got 1 drop beat, and the next beat occurs in expected place and expected time. There is, we don't have any expected time and expected place. For example, this is long gap and long cause of electrical inactivity of the heart. Finally, the SA node doesn't work, but immediately the atrium is activated. This is called this complex. This is called atrial escape rhythm. When the SA node is damaged, or when the SA node doesn't work, or if the SA node is destroyed, what will happen to the heart? When the SA node is damaged, there are other parts of the heart electrically activated. Other parts of the heart are electrically activated, and they start jobbing of the SA nodes, or they start working instead of the SA node. This is called escape rhythm. We have got 2 types of escape rhythm. One is AV nodal escape rhythm, another is ventricular escape rhythm. If the SA node is damaged, the second part in heart which is activated is AV node. If the AV node is damaged, the third part of the heart which is electrically activated, ventricle. Ventricular escape rhythm. Right now we'll be discussing about the AV nodal escape rhythm. If the AC node is damaged or doesn't work, or it is destroyed, there are other parts of the heart are electrically activated, which is also called subsidiary pacemaker. For example, if the AC node is damaged, the second part is AV node. AV node electrically is activated. And how should I distinguish this AV nodal from normal sinus rhythm? The criteria for AV nodal escape rhythm. The AV nodal escape rhythm, the heart rate will be 43 beats per minute. 43 beats per minute. Because we have got 1 square, 2, 3, 4, 5, 6, 7. If 300 should be divided by 7, we produce 43. The criteria for the AV nodal escape rhythm. The criteria for AV nodal escape rhythm. That the SA node is damaged, AV node is electrically activated. How should I diagnose from the ECG the is AV nodal escape rhythm? The firing frequency of the AV node represents 43 beats per minute. P wave does not present, and QRS complex is narrow. Different. In the normal sinus rhythm, we have got the heart rate between 60 to 100 beats per minute. Every P wave is followed by QRS complex, and QRS complex narrow. But the AV nodal escape rhythm, first the heart rate is 43 beats per minute, and the QRS complex is narrow. And another criteria, P wave is absent. So AV nodal escape rhythm have got 3 criteria. One of them is called the heart rate is 43 beats per minute. The P wave is absent, and the QRS complex is narrow. This is called AV nodal escape rhythm. If the AC node doesn't work, then the AV node doesn't work. What will happen to the heart? The third part of electrically activated ventricular escape rhythm. How should I diagnose ventricular escape rhythm from the ECG? Where is ventricular escape rhythm? Yeah. Ventricular escape rhythm. For example, the heart rate of ventricular escape rhythm is less, 33 beats per minute. And another, the heart rate 30 beats per minute. QRS complex is wide. Why it is wide? Because it is originated from the ventricles. And this is the QRS complex is wide, and the P wave is absent. Differentiation between the AV nodal escape rhythm and ventricular escape rhythm. Atrial escape rhythm, when the AC node is damaged, there are other parts of the heart electrically activated. One of them is called the AV node. The AV node produces a rhythm. After if the AC node damaged, this rhythm is called AV nodal escape rhythm. The ECG criteria for AV nodal escape rhythm, the heart rate should be 43 beats per minute. The QRS complex is narrow, and the P wave is absent. If the AC node doesn't work, the second part of the heart which is electrically activated, AV node. AV node also have got their own rhythm. AV nodal escape rhythm, firing frequency 43 beats per minute, QRS complex is narrow, and P wave is absent. If the AV node doesn't work, what will happen to the heart? There are other parts of the heart that are electrically activated, especially ventricle. What is the criteria of the ventricular escape rhythm? Where is the ventricle? This one. For example, we have got 1, 2, 3, 4, 5, 6, 7, and 8. When 300 divided by 8, the heart rate becomes 33 beats per minute. The critical feature of the ventricular escape rhythm, the heart rate is 33 beats per minute, the P wave is absent, and the QRS complex is wide. If the AC node is damaged, and the AV node is damaged, and ventricular escape rhythm does not occur, or it is also damaged, what will happen to the heart? The heart will produce asystole. How should I define the asystole? Where is the asystole? Asystole. Asystole implies or shows absence of electrical activity of the heart. When you are talking about the asystole, we should think about the absence of the electrical activity of the heart, and the heart rate becomes 0. And the heart rate becomes 0. This was about the asystole. The heart rate 0 after sinus arrest, cardiac arrest occurs. Finally, again, if the AC node is damaged and the AV node is activated, if the AV node is damaged, ventricular escape rhythm is activated. If the ventricle is damaged, or AC node, AV node, the ventricular, what do they produce? They produce straight lines. They produce straight lines, and the heart rate in such a case becomes 0. When sinus node is arrested, cardiac arrest is also occurred. So in cases of the sinus asystole, asystole implies absence of the electrical activity of the heart. Heart rate is 0, and heart rate is 0, and it is representation by prolonged straight lines. and this is acute emergency situation. So this patient should be referred, or if there is somebody, they should do something for the patient during the cardiac arrest. And this is also called asystole. Asystole, absence of the electrical activity of the heart, and they produce a long straight lines. And this is acute medical emergency. We will be discussing about the asystole and cardiopulmonary resuscitation. But when the SA node is arrested, the cardiac heart maybe is also arrested. Did you understand? SA node is activated, doesn't activate, AV node doesn't activate, and ventricle doesn't activate it. What will happen to the heart? Asystole. What does it mean, asystole? Asystole, absence of electrical activity of ventricular heart, and the heart rate is the heart rate is 0. Remember, this asystole sometimes is confused with ventricular fibrillation. They also produce a straight line. They also produce a straight line. So in that case, the DC shock is very useful. In such a cases, it needs another procedure that we will discuss, especially pacing. This was about the asystole. So in treatment of the one thing that I should forget, association of sick sinus syndrome. Association of sick sinus syndrome with paroxysm of atrial tachycardia, especially when sick sinus syndrome, I mean this bradycardia, first degree, second degree, this annular block is association of sick sinus syndrome with paroxysm of tachycardia. That is called tachycardia syndrome. Right now we'll say again, if the patient if sinus bradycardia is associated with atrial flutter or atrial fibrillation or part, this is called tachybrady. For example, this is a brady. This is bradycardia. After bradycardia, tachycardia is produced. But this tachycardia is related to the atrium. For example, atrial fibrillation, tachybrady syndrome. Do you know about that? If there is a pause of the bradycardia, after the pauses of bradycardia, the atrium is electrically activated, and after the tachycardia, they produce flutter or fibrillation. This is called tachybrady syndrome. Did you understand this one? Yeah. This was about the tachybrady syndrome. Remember, in case of tachybrady syndrome, we should be cautious about the administration of the antiarrhythmic drugs. For example, if a patient was in bradycardic stage, if you give for the patient beta blocker, it becomes furtherly deteriorated, and the bradyarrhythmia pauses prolonged. So be cautious about the administration of the drug, especially antiarrhythmic drug, in those people who have got tachy and brady syndromes. Yeah. Causes of the sick sinus syndrome. Causes of the degeneration of the SA node is one, and fibrosis of the conduction system of the SA node is the most common cause of the SA node. Other causes, for example, ischemic heart disease, drugs, especially digoxin, quinidine, and beta blocker, they also produce bradyarrhythmia. This is the cause. Another cause, especially cardiomyopathy, amyloidosis, and myocarditis. The causes of sick sinus syndrome. Number one is degeneration of the SA node, as well as fibrosis of the conduction system of the SA node. This is the one. The second thing is ischemia. Another is drugs, especially digoxin, quinidine, and another beta blockers. And another one is cardiomyopathies. Another amyloidosis. And finally, myocarditis. This was causes of the sick sinus syndrome. After the sick sinus syndrome, diagnostic tool. How should you make diagnosis of the second degree or symptom of the sick sinus syndrome? Symptom, this is a bradyarrhythmia. We have discussed about the symptom of sinus bradyarrhythmia already. The common causes, we have discussed about the causes, and also I discussed about diagnostic tool. Diagnostic Holter monitoring or 24-hour ambulatory ECG recordings. For diagnosis of the sick sinus syndrome, you should use Holter monitoring. This is also ECG, but in this is called ambulatory ECG recording, and near to or next to the bedside of the patient, you should connect the patient to the Holter monitoring. If the patient, association of the clinical syndrome of the patient and with ECG, and the patient develop chest pain, palpitation, syncope, fainting, this represent sick sinus syndrome. Treatment of sick sinus syndrome. If sinus syndrome is asymptomatic, does not require treatment. The patient does not have vertigo, dizziness, chest pain, palpitation, fainting, does not need any treatment. If sick sinus syndrome becomes symptomatic, the patient needs pacing. The only treatment of this case is pacing. So treatment of sick sinus syndrome. If asymptomatic, the patient does not need any treatment. If the patient becomes symptomatic, they need permanent pacing. This was about the sick sinus syndrome. Right now we repeat and should also help with me.
Finally.
First of all, we should discuss about the sick sinus.
Finally.
Oh, remember, this is not should be forget. Yeah. If bradycardia is severe, we have discussed this. If bradycardia is severe, or if sing arterial block, or sinus arrest becomes prolonged, what will happen? The patient, what will happen? Escape rhythm and escape beat is produced. If sinus bradycardia is severe, for example, it reaches the heart rate become less than 30. And if the sinus bradycardia is severe, or if the synodal block or sinus arrest becomes prolonged, what will happen? On the heart, escape rhythm and escape beat is produced. Did you understand? Right now, again, what is the sick sinus syndrome? Sick sinus syndrome is